Today we're going to be doing repetitions for the isolation precautions. I recommend you watch this video every day. Memorizing your isolation precautions will help you to be effective in infection control, which is a major component of the NCLEX and also for your future nursing career. So in this slide, we're talking about the different types of isolation precautions. You have airborne, droplet, contact, and enteric. When a disease requires airborne precaution, that means that disease is spread through the air. That means if you breathe the same air as an individual who's infected with these diseases, you are at risk for getting that infection. Droplet. A disease that requires droplet precautions means that the disease is spread by tiny droplets that usually are generated when the person with the infection either talks, coughs, or sneezes. Coming in contact with those droplets and having the droplets enter your nose or your mouth places you at risk for developing that infection. A disease that requires contact precautions is spread through close contact with an infected person or something that an infected person has contaminated. A disease that requires enteric precautions. So when you see the word enteric, I want you to think GI, gastrointestinal. And usually what this means is the disease is spread through infected fecal matter. So if a person with an infection that requires enteric precautions has a bowel movement and someone else comes in contact with that fecal matter, they are at risk for infection. What is the nickname that we give to the group of diseases that require airborne precautions? Me chicken has TB. Me chicken has TB. What is the nickname for the group of diseases that require droplet precautions? Spider-Man. What is the nickname for the group of diseases that require contact precautions? Mr. Vice President. And what is the nickname for the group of diseases that require enteric precautions? Crunch. So remember, the nickname for the diseases that require airborne precautions is Me Chicken Has TB. What does the me stand for? Measles. What is the other name for measles? Rubiola. What does the chicken stand for? Chickenpox. What is the other name for chickenpox? Varicella. What is the S in chickens for? Severe acute respiratory syndrome. What is the other name for severe acute respiratory syndrome? SARS. What does the HAS stand for? Herpes zoster. What is the other name for herpes zoster? Shingles. What does the TB stand for? Tuberculosis, which is TB. Airborne requirements. What type of room should the patient have? Private. What type of pressure should the room have? Negative. What type of filter should the room have? A HEPA filter. How many air exchanges per hour should the room have? 6 to 12 times per hour. 6 is the minimum for an existing building, and 12 is the minimum for a new building. 12 is preferred. What type of PPE or personal protective equipment should the nurse wear upon entering the room? An N95 respirator. And what should the patient wear if they have to leave the room for a medical necessity? A surgical mask. The way that you can remember that Me Chickens has TB is for airborne precautions. Just remember that you can put chicken in the air fryer. Then you get a question on your NCLEX that says, which of the following diseases require airborne precautions? So you're just going to think airborne, air fryer. I can put chicken in the air fryer. Me Chickens has TB, measles, chickenpox, SARS, herpes zoster, tuberculosis. Next up is droplet precautions. Remember, the nickname for all the diseases that require droplet precautions is Spider-Man. And you can remember this because Spider-Man, he won't drop you. Okay? So what is the first S? Scarlet fever. What is the next S for droplet precaution diseases? Sepsis. Very good. What is the last S? Streptococcal pharyngitis. And what is the other name for streptococcal pharyngitis? Strep throat. Very good. Remember, your pharynx is your throat. So streptococcal pharyngitis is strep throat. Then we have 3 P's. What is the first P? Parvovirus. What are the 3 other names for parvovirus? Slapped cheek, B19, and fifth disease. What is the next P for droplet precautions? Pertussis. And what is the other name for pertussis? Whooping cough. And what is the last P for diseases of droplet precautions? Pneumonia. What is the I? Influenza. What is the other name for influenza? The flu. The word's right in there. What disease starts with a D and requires droplet precaution? Diphtheria. What does the E stand for? Epiglottitis. What are the R's? Respiratory syncytial virus or RSV. Rubella. What is the other name for rubella? German measles. And the last R? Rhinovirus. What is the other name for rhinovirus? The common cold. And what are the M's? Mumps. The last M? Meningitis. And finally, the A and the N? Adenovirus. So droplet precautions. What type of room is preferred? A private room is preferred. However, they can have a cohort, which is a roommate with the same infection. We have to keep them 3 feet apart and keep the curtains drawn to separate them. But if a private room is available, that would be preferred. What PPE should the nurse go in with? A surgical mask. And if the patient has to leave the room for a medical necessity, what should they wear? A surgical mask. Next up is contact precautions. What is the nickname we say for the diseases that require contact precautions? Mr. Vice President. So what does the MR stand for contact precautions? MRSA. What does the V stand for? VRE. What does the I stand for? Impetigo. What does the C stand for? Clostridium difficile or C. diff. What does the E stand for? E. coli 0157. What does the P stand for? Pediculosis capitis. And what is the other name for pediculosis capitis? Lice. Very good. What does the S stand for? Scabies. So, contact requirements. What type of room should they have? A private room is preferred. What PPE should the nurse wear upon entering the room? Gown and gloves. Remember, this is a contact disease, so that means this disease is spread through close contact. Enteric precautions. What is the nickname we say for the diseases that require enteric precaution. Crunch. A disease that requires enteric precautions means that the patient's fecal matter is infected. The nurse should use extra precaution when handling the patient's fecal matter. So what does the C in crunch stand for enteric precaution? Clostridium difficile. What does the R stand for? Rotavirus. What does the U stand for? Undiagnosed GI infection. What does the N stand for? Norovirus. And what does the H stand for? Hepatitis A. So C. diff or Clostridium difficile is considered both contact and enteric. Enteric precautions is just letting you know that it's specifically the fecal matter of the patient. That is where the infection can spread if you're not careful. Also remember, rotavirus causes a lot of diarrhea. So just think rota turns your stomach into a motor. It turns your stomach into a motor because it's like you're going to be having a lot of diarrhea. Also for hepatitis A, I want you to think hepatitis anus because hepatitis A is spread through the fecal oral route, which means when a person with hepatitis A has a bowel movement, their feces can spread the infection. So if somehow fecal matter of the patient gets into someone else's mouth, that is how hepatitis A is spread. Requirements. A private room is preferred. However, they can have a cohort with the same infection. And what is the PPE that the nurse should wear? Gown and gloves. All right, everyone. So again, remember we reviewed the isolation precautions, diseases that you must memorize so that you can be successful with the NCLEX. I want to thank you so much for spending time with me. I hope this video was helpful to you. If there's anything that I can do to help you to succeed with your NCLEX, please give me a call today at 407-907-3737 and visit me at yourtimetoexcel.com. Have a wonderful day.